Hello doctors, have a beautiful day. Today we are looking at the human diseases caused by rickettsia and the oriental species. So in case of the typhus group includes the R. provazacchi. So R. provazacchi, the diseases caused are the epidemic typhus and the Brill Zinsser disease. So the vector here is the louse and the reservoir is the humans. Now looking at the clinical features of the typhus, it includes the rash as well as there is no eschar. Next we are looking at the R. typhi. So in case of the R. typhi, the diseases transmitted is the endemic typhus. And the vector, if you see, the vector is the rat flea. Reservoir here includes the rodents, and the clinical feature is nothing but rash and there is no eschar. Next, moving on to the group of spotted fever group. Spotted fever group. So in case of spotted fever group, there is the R. rickettsia. So the disease here is the Rocky Mountain spotted fever. Now looking at the vector includes tick and the dermatology andersoni. And looking at the reservoir is the rodents or the dogs. Next, moving on to the clinical feature of this. Clinical features, it includes the rash is positive. Next, there is no eschar and there are many systemic manifestation. Next, looking at the R. coronary. So in case of the coronary, it is the disease is the Indian tick typhus. And here looking at the vector is the tick. And next, moving on to the reservoir. The reservoir is the rodents as well as the dogs. And now looking at clinical features, it includes the tachynoid positive as well as the rash is positive. Then we are looking at the R. acari. So in case of R. acari, the disease is nothing but the rickettsial pox. And moving at the vector is the gamacid mite. And now moving on to the reservoir. Reservoir, if you see, it is the mice, and the clinical feature, it includes the vesicular rash and the eschar, which is positive. Next we move on to the scrub typhus type. So in case of the scrub typhus, here we are looking at the O. Tsutsugamushi. So the disease here is the scrub typhus. And next, looking at the vector. The vector includes the trombiculate mite. And moving at the reservoir, looking at the reservoir, it is the rodents. And the clinical features, it includes the rash, the eschar, and the atypical lymphocytes.